Have you ever been involved with your ideas, particularly your Sudanese? Have you been involved in even in inspiring young Sudanese there about their future? Because you know there are thousands, if not thousands, sitting on the street drinking coffee and tea, playing cards 2 o'clock in the morning along this, Buyut Salat, the communication tower. They are all graduates. How you could inspire them about the future? Sudan is not a foreign state as they see. Have you done any? Have you been engaged with Sudan?
So as of now, no,
as a young, yeah.
As of now, I've not really been engaged with really anyone outside the organization because my involvement's only been around 1.5 years now.
Yes.
But I think the important thing is that.
Do you travel regularly to Sudan?
Yeah. So.
And when you travel, do you do any engagement with young or universities or?
Unfortunately, not. No.
Okay.
I think the problem is,
yes.
If I can interrupt as well.
We come back to the doctor's one. I just wanted to get this one. Yes.
I think it kind of makes this. You don't want to go there and make it seem like you're from Sudan and you trained here. You don't really know what you're doing, but because I trained abroad, I know what I'm doing. So I'm going to tell you how to do things. You run the risk of coming across like that if you do try and do that, and that also links to sustainability.
Yes.
It's more of a collaborative partnership thing where we can all use.
And that's the one we want to ask you.
expertise.
How do we create that collaborative where you, the 3 of you other examples, can actually be embedded with your counterpart there in Khartoum or Jazeera universities as your mates? How can you create that culture of partnership?
A lot of people have tried, and I personally have tried with friends and other medics and economists to try and get things like that involved. And it's really hard, and there's barriers at pretty much every stage. Trying to get funding to run workshops or programs, that can be difficult. Trying to do something that's sustainable, that isn't just a one-off, that's also really
So the funding is the main issue.
Yeah, I think funding.
And what
is
about
an
government? Do you get any help from universities or vice chancellors?
As in
Sudan.
So I think the main thing in terms of trying to replicate something like that in Sudan is confidence. You need to give the students confidence that they can do it. Okay. So the reason it was so successful at Cambridge was that we're already being pushed constantly with this fake confidence that you can do everything, you can do anything, which is not very true. But there's this illusion of confidence that we get in our university, and you just need to give the students in Sudan the confidence that yes, they can set up things like this, they can do it, and people will want to hear them. And then you need to get the people who are in the parliament and in government to support them and include them in discussions. But that's not happening right now. You're having the governments are doing their thing, and the students are just studying, not caring about anything outside their studies because they feel the only way to succeed is to do well in your exams.
And to get out of Sudan.
Yes.
And to get out of Sudan.
And that's where the big,
Yes, this is very useful. This is why Abdurrahman, can you answer her question if you about the doctors going to Sudan to train? Because you travel a lot to Sudan.
Yeah.
Can you answer that or we ask Mayala?
Yeah, that's fine. The problem is medical fields are always updated. So we're always we've got more specialties now. We've got about 60 odd subspecialties. For example, if I give you one example out of many, I do intervention as well as diagnostic radiology. Intervention in Sudan, there's no service for intervention radiology in Sudan. That's for example, just one example. So what we did is last time we did get 2 consultants working here and went there for intense educational program for the radiology registrars to get that kind of a skill. And it's a matter of interaction. Also, we need to learn a lot of things like, for example, communicable diseases, malaria and stuff that sometimes happen here sporadically. We need their experience. So we need to engage in a collaboration and exchange of information rather than just stay in Europe. In Sudan, people in Sudan teach each other, and here in the UK teach each other. So we need that kind of approach.
We do have good surgeons in Sudan. All what they need to have a system of regular update. Here, you get into you have to attend 50 hours per year or something and something. So the most contribution we can do is we are exposed here to systems, and we are exposed to systematic ways of solving problems. And I think the best way for us is to translate that in Sudan. Instead of, so introduce a system of update, as I said, that the world become a one village, people can get updated, even in surgery, even in intervention radiologies, and you can bring someone here to learn for a couple of months and go back. But the notion of, oh yeah, I am an expert, so I'm gonna spend 1 week or 2 weeks every year going to Sudan doing surgeries or teaching, treating patients, I don't think that is a good way of spending your time as a practitioner or the time of people in Sudan, or you are benefiting the patient you are treating in Sudan. Sudan احنا درسونا بروفيسورات some of them are still alive وربنا يديهم الصحة والعافية, and they are very 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 good. And some of them توفوا ربنا يرحمهم. فالسودان مليان and it is full والد وفيه كمية كبيرة جدا من good doctors and practitioners.
Right. I will give you the chance, but because one of the things we try to help through the both universities here and focus on this project is being tried here in East London. You remember when there was lots of problems with the black youth who have been out of schools and so on in East London? At that time the mayor was, what's his name, King Livingston. And the idea was suggested, but not by me, by a professor from East London at the time. He suggested we choose some black role models, like Trevor McDonald and so on, and we put them together. So the mayor of London funded that project. So they will tour counties, say they go to whatever, say Victoria area or Brixton, whatever it is, or East London, and they talk to young who are out of school, not as bright as these people who are in school, universities now, and try to show them, I am a Sudanese or I am a Nigerian or whatever, and they can show them how hard they went through the system, like Trevor McDonald, who became one of the best, or like, what her name, Zainab al-Badawi, one of the best, for example. So they can show the young Sudan. The good thing is in Sudanese, we have lots of good, bright examples like this. So I think that might be, this is what I suggested for Sudan. Why not you have a motivation talk by people like this to the young generations, there thousands. Out of this, the talk they just gave, like Muhammad talk, is completely out of politics. Not about the politics, out of whatever happened. It's nothing to do with what government now or the previous or the forthcoming one. It's about how to motivate these young generations right now to still see the future there. Because most of them, they don't see the future. They don't see, they're blind. They see themselves as they have no hope. Really, they have no hope. So I think that's, we can send this message and promote it, yes.
It's really hard psychologically, it takes a toll.
Yes.
When you're constantly shut the doors on you because you're Mexican, because you're Sudanese, because you're Muslim, because you're a Christian,
Yes.
because you're an atheist, like whatever. And like, of course, it's I think you raise a really important point. We have to keep young people motivated.
Motivated, yes. Yes, I'll give you the chance now.
We had wonderful presentations about, how to devise good, healthcare strategies and policies and so on. But I think in the second presentation, there was, one of the figures suggested that more than 85% of the healthcare professionals and doctors would like to immigrate and leave the country.
Yes.
So I think we do have an issue. The main issue we have is really the brain drain. I mean, and I think if this research was taken further, most of these people would say we're not returning. They won't have any definitive or clear plans to return back to Sudan. So even if you have the best of, no matter how much you invest in the healthcare policies, if the qualified and trained people leave the country and don't come back, then you have a real problem, because there aren't any people coming back to implement these policies. And this is I think this is the situation, status quo at the moment in Sudan. In the past, yes, I mean there were good professors and teachers who used to stay, people who used to train in Sudan and stay there. Even people who left the Gulf, they used to come back. But I'm a medical trainee myself, and I know most of my colleagues would not think not in the next 5 or 10 years to return back. And even if they think about leaving, maybe they get trained in the Western countries, in the UK or the USA, they will think about going to the Gulf. So everyone is focused on developing their own kind of lifestyle and so on. So I think we need to focus on how we can convince people. Is it just creating a culture of sacrifice? People have to our generation have to sacrifice, having good conditions and return back despite all the economic issues. It's difficult. I don't know how.
And that was actually said by Ahmed Abdullah. He's a dentist. He's one of the young, smart Sudanese. He's a dentist, specialist. He wrote here, he said, أتمنى أن يتم وضع مخطط للغياب from رياض سعودي أرابيا وضع مخطط للغياب بزيارات دورية للإخوة الأطباء في الخارج على مدار العام والقيام بعمل ورش للاستفادة من الجانبين منها معرفة الأطباء في الخارج والاستفادة منهم وفي نفس الوقت أن يضع الأطباء اللي هم زيهم كده بصمة تمهيدية لعودتهم طال الزمن أو قصر. جميل أن نرى أبنائنا بنتكلم عنه قلت معه هو يعني بهذا الكم من العلم والمناصب. وباي ذا واي كبير بعد ما هو جاب من لك يسبيك اب اللي هو رئيس النقابه انا استهلك لك اكسلنت و يعني ما شاء الله. فديس از برضه امبورتنت لانه في النهايه انا داير بس تو ريمايند يو وات از ا ريسنت ديفلوبمنت في الستاديز بتاعت الميجريشن. It's showing that countries like UAE, like Europe, for example, like in the UK, they are advancing their understanding of including immigrants in their system better. For example, here you can see in this country, more mosques, understanding to Muslim. Now your kids can have a holiday because of Islam, whatever. This why? Because they want to make it much more like inclusive for you. So this is actually is working opposite to Sudan and the countries which are sending immigrants like us. Saudi Arabia, for example, you cannot feel you are actually out of home because you can get the food, you can get neighbors, you have your families everywhere in Abu Dhabi, whatever it is. So you don't feel so much homesick like if you are in. So this is other thing. Other countries are actually advancing their, if you like, incubation of immigrants. So they have to find a way. Yes.
Through all these years, at all time I compare between the system here and there. I think in Sudan we need to make an urgent call for all expertise. All the consultants to come back in Sudan, just like a new policy, which is supposed to be strict. Because there are many, qualified doctors, as Dr. Mayada said, but they are so desperate, they want to give something to the country, but unless the government, gives the importance to the minister, to the health, giving a nice budget. And sometimes even the health itself, sometimes it be ruined by bringing people who are not, know nothing, about how, to rule things. So what I need to say, take any part of the health, for example, surgery. Bring consultants from Europe or America and try to make new rules for the hospitals. And as you said before, the operation itself could be, successful, but regarding the follow-up. So we need to put anything regarding the pharmacy. We need to put, new policy for the pharmacy and how we can, stop, people to interfere with people who are working in each sector. So, and I'm so sorry, when I see my colleagues and other doctors, fleeing the country, and the Minister of Health itself said, the system itself in Sudan is not going to be affected. I saw himself, coming to the, Coronel Hospital, and I asked him, why you are coming here, why you are destroying, the biggest hospital in Sudan, Khartoum, for example. And I think it did by intention, destroying the government hospital and gives the chance for other private hospital to take the profits. And nobody, is taking care about ordinary people.
No problem. عبد الرحمن, there is two questions. التأمين الصحي أبدا فهو لا يغطي كل الأمراض والعلاج. They say medical insurance does not cover all type of أمراض and treatments في المراكز الصحية فقط. بالإضافة, in addition, the loss of difficult procedures to get that medical insurance working. Is that correct?
So the first
doesn't cover everything.
Yeah, doesn't cover everything. The UK system doesn't cover everything.
Okay.
If you say the spending.
No, but the UK cover
No.
free.
No. You don't cover some of the fancy stuff. What I'm trying to say is you can't cover everything financially and.
Rahman, you just mentioned it yourself. Fancy stuff. Forget about the fancy.
Yeah. But the essential stuff is
covered.
The essential stuff is from the premium now is covering primary, secondary, and tertiary. It gets subsidized for pharmaceuticals, so it's a complex premium. It's not.
I guess even in Sudan.
So yes, right. So The short answer, yes, right. It doesn't
Doesn't
cover
cover
everything.
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 And the procedure is very complicated.
The procedure, some of the things are easy, some of it is complicated,
But what
especially
is-
for the surgeries.
لكن
It's very complicated.
It said the private one, أما التأمين الخاص, yes, it covers
Yeah,
everything.
there is the problem is
But it's
the
very expensive. You
the
need-
private the private insurance is very expensive. It's not. We're talking about something from 800,000 to nearly 12 million in a year. That's also the least bound. That's the private insurance. So the private insurance actually is out of the discussion. I think we need to talk about the insurance, government-based, state provision, state subsidized insurance to achieve universal health coverage first and build on it.
Okay. One question from Husham. He said it before. Have we lost you now? No. What is this one? Okay, we'll come. Yes, Shum.
I'm going to talk about the whole thing, yeah?
Okay.
Improving the general, the national health service in Sudan, yeah? So this is not about a specific presentation, about the whole thing, yeah? I think, I'm assuming that the political will is there. So, and the question now, the challenge is for us is, technically, what do we need to do to improve the health service? In my opinion, the first thing we need to do is to get the experts in the decision-making roles, yeah? So that's the first thing. We need to benchmark, and I believe Dr. Husham said this in Facebook, you mentioned it earlier, Professor Allah, is that we need to look into other countries with good experience in the national health service, whether that in Europe, America, whatever. Who is better than us in this field? We need to benchmark. We need to learn from them, find out what they did and how they did it. And then the most important thing is to have a strategic, a high-level strategic plan for improving the national health service. Because without a strategic plan, all of us will be doing, we discover problems here and there, we'll have individual, isolated, scattered efforts, yeah? And there will be gaps in the system. We will never manage to improve the whole overall thing. So the good thing about strategic plan is you have a high level objective at the top, is that what do you need from the national health service? What do you need the national health service to do for you? Yeah? And then from there, you will try to identify what you need to do to achieve that objective. And this will lead you to find out what is required in each area. So we're talking about things like, most of these things we just mentioned. We're talking about improving the conditions for doctors to stay in Sudan, not to immigrate. Training of doctors, how to raise the standard of the doctors, yeah? And we're talking about getting equipment, we're talking about drugs, getting the right drugs on time, we're talking about maintenance, we're talking about setting policies and procedures to sustain the improvement, to sustain what you did, yeah? So, in my opinion, that's the conclusion. We need high-level strategic plan. Without that, we will be doing everybody working in the field. We don't understand who is doing what. There could be duplication of effort. There could be areas that there is gaps on it, but nobody's addressing it. Yeah. So this is my my conclusion.
Khartoum Teaching Hospital, as part of many tertiary hospitals, actually just cost 8% of the total health expenditure. So I'm not advocating to get money from the secondary or tertiary hospitals. I'm actually advocating for the new money to come to the primary. I just leave it, because even if we took the money from the teaching hospitals, like example Khartoum, that will not scratch the surface of the primary health care, the out-of-pocket spending in primary health care services, which cost about 35% and about $1 billion. So That's the cost of the primary health service. So what I suggested here is a social care budget that's allocated in the current Sudan budget in 2016 to be mobilized from the social care, okay, not from the hospitals, not from tertiary or secondary care, to be mobilized from the social care to the primary care services, primary health care services, directly allocated to primary care health services. I'm not actually advocating to abandon the tertiary or the secondary care, but the priority should be given to primary care.
To make a real and measurable change, you have to think systems, and you have to change your approach of thinking. You have to think solutions. You have to look at assets. You have to have the right leadership, and you have to have resources spent in the right way and across the right priorities. Your priorities have to be informed by evidence-based, and in terms of the role of the diaspora, if we say for the diaspora you go home, that's unrealistic ask. But if you want your contribution, you have to think of sustainability. You have to go and leave something sustainable, teach and train rather than just do. And when you leave a legacy and you leave something behind. So, and in terms of the youth, I think there is a huge task for all of us as diaspora or in Sudan to be able to inspire, to make the youth feel valued, and to increase their contribution to the health and healthcare system.
Okay, thank you very much. Mohammed, can I ask you to give us also your takeaways home on behalf of these young generations?
And then pulling on the point my colleague said before, I think an important thing is that we shouldn't go as Westerners or diaspora saying, oh, we've seen how it's done right, this is how you do it right, we know how it's done. The important thing is to try and encourage this homegrown effort amongst the youth where they feel confident in their abilities to benefit public health policy, and they're supported by the systems and the people that are around them.
Excellent. Thank you very much. Can I ask you, because you introduce yourself, and one of you give us a final goodbye before we go. We want to give you a chance. We want to know who you are. Quickly, yes.
My name is Albir Levin. I'm a dentist. She's a student.
You are a dentist. You graduate or you student?
I graduate.
MashaAllah, you're one of the big earners in this country. So you know the topic is. Yes, thank you, yes.
I'm actually working in Sudan right now. I'm doing my...
And where did you study here?
No, I studied in Sudan.
MashaAllah, okay.
So I'm like experiencing firsthand the lack of resources and how to utilize what we have and stuff in front of us. I like the way kept mentioning about sustainability and how to use what we have, because all this, the ideas and stuff that people are saying, just all for the long term. We need ideas like short-term solutions to manage, just micromanage what we're doing day to day, and do treatments now, early treatments, initial treatments and stuff. So I think we need to all of this is the whole healthcare professionals.
Speak up a little bit. Why all these doctors?
I think just as a whole, we need to think of just as a short-term solutions to our problems as well as the long-term that's happening, because all this stuff is all just future goals. But right now we need stuff that to help the patients. This is all for the care of the patients and for the healthcare professionals. We need also short-term goals as well as long-term.
And since you are currently working in Sudan, does what happened today make sense to you from what you just said?
Yeah, it's all relative, and it's all very good.
Okay, and you?
Yeah. Unfortunately, I don't have any experience of working in Sudan. I lived in Sudan when I was younger, and I just came here when I was 11 years old, and have been here since then. I know that the health system is a problem, okay, and we can all recognise this, even the non-doctors in the country know this is a problem. But it's just something that something like this has just kind of showed that people do want to do something about it. Okay, it's making me proud that we all want to work together to make the health system better in Sudan. I want to go back to Sudan and, you know, use what I've learned here and to try and help, you know, in making things better back in my country and help, you know, family and just the Sudanese people. And just as a take-home message, well, they have some things to share with all of you. I've worked with a consultant once. He said that one of the best doctors and the kindest doctors and the smartest doctors I ever met was Sudanese doctors. So,
yes, thank you very much. Well, that's very good. And you finish it for us.
Oh, no pressure.
But with your eyes, speak out loud.
My name's Ibtihad. I'm a public health graduate, so this is all right down my alley, and really enjoyed all the talks today. They're all excellent. Takeaway message, or the thing I would like to share is similar to what you said, is that you can see here today, and through people that you'll meet, you'll see that Sudanese people are a proactive group, and they are interested and they do want to go back. So I think sometimes it's quite unfair to say people are leaving the country and they don't want to contribute. People do want to contribute, and it's just a matter of how do they do it. Like, you have people who are growing up here, they're British people. When they go back to Sudan, how are these people in Sudan don't know how to navigate? How is someone from out of Sudan going to go back and navigate the complexity of the country? And I love the talk that Dr. Mayadi gave and what she was trying to put across about the system approach. The system needs to be there. People want to go back, but what are they going back to? So I think, that's my idea. So yeah, if people want something to go back to, so hopefully if the infrastructure is in place and you have the inspiration and people can be mobilized to contribute as they would like to. Thank you.
All these people you have seen, even the one, you came from Ireland, right? All of them, they paid from their own money, and I appreciate it because I know how much commitment you have put into this one. Not only financial, but also your own time. I know how much this is a consultant, hard day, maybe 2,000-3,000. But thank you very, very much. So, yes, I will give you chance, but let me just say this one. But also, we are very grateful to all these institutions. This is a platform, it's a platform. WASP is a platform, like you called it before. It's a platform. If you need to do anything, please do. And also, this is the website of the project, which we do. Most importantly, if you want, you can see it here, go and have a look at it. All these videos will be available. The PowerPoints, particularly the professional video, which is really has been very. Patricia, thank you very much. She came all the way from Brighton. Everyone here is traveling, actually. Thank you very much. Without her, we wouldn't have this technology and way. All of you, thank you very much. Could you please help me to show our appreciation to those speakers again for the second or fourth?